And now to our main program, and to introduce our program is our member, John Adams. He's going to share a personal story so that I ask you give him your undivided attention. John, come on up.
Hi. Well, most of you know me through environmental conservation activities in the Rotary Malaria Partnership, but I'm here to talk about a personal story around mental health care. Hopefully by the end of this session today, we'll have a greater understanding and compassion for these conditions. So before we start, what I'd like you to do is to consider this. Anybody that does not have a family member or a friend that is close to them, anybody that does not know anybody with a mental health care problem, please raise your hand. Okay, you don't know anybody with a profound mental health care problem. So there are about 4 people in the room, and that implies that everybody else in the room knows somebody that's a family member or a friend or close acquaintance that has experienced mental health care problems. That tells us we're all here as a community in this. If we could have the next picture, I'll explain. My wife Andrea and I have 4 children. We have 2 children that are adopted and 2 that are what I'd call natural. And one of our adopted kids is on the left here. It's Peter. Peter we adopted at age 2.5 from Khabarovsk, Russia. That is 500 kilometers north of Vladivostok, 1 time zone east of Siberia. And we adopted him at a time that the Russian economy had crashed, and children were literally starving in Russian orphanages. So when we adopted Peter and spent a month in Russia and brought him back to the United States, he had various problems. He had an eating compulsion. We couldn't take him to be with other children. In a birthday party, he'd just eat all the food before it started. He had reactive attachment disorder, which required extensive therapy, sensory integration issues, and he worked through those over the years when he was very young. Later on, he had a broad cluster of mental health issues that were called things like mood disorder, conduct disorder, and impulse control. These were so severe that we had to have 24-hour care at school and in the home in addition to parenting. And there was about a 5-year period where we didn't have anybody over or go to anybody's house because it was just the management of a child with these disabilities was so all-consuming. Finally, he was kicked out of all of the local public schools and had to go into therapeutic institutions. One of the things that we found out is that all the therapeutic institutions in the state of Washington had been closed, and they have been, by the way, for many years because our laws allow that any child can ask for their own release at age 13 and walk out of any institution. So what happens with all children with profound mental illness in the state of Washington is that parents have to find places in Texas or New Mexico or Utah, and the child is further traumatized, losing their only core support system by having to go to a different state for therapeutic care. Peter overcame that. He went through all of the various problems and he had intensive therapy, and he worked on ranches, and he came through with just amazing grace and composure, and came back, graduated from high school locally, but he was left with 2 things. One is some chronic impulse control issues, and the other one was what is called bipolar 2 with psychosis. That's a formal diagnosis. It's the same thing that was the case with Anthony Bourdain. So Peter, he was very, very lucky to have transitional housing at the YMCA. And at the YMCA, it provided the social structure. He took his medication most of the time. He mentored other people. And he was generous and well-loved. Physically, he looked like a Russian gymnast. He was just an Adonis of a guy. And that, along with big Russian bear hugs, earned him a lot of community and love. So what happened, you can see Peter there with me at a Christmas. What happened last month is that Peter aged out of the program at the YMCA for transitional housing and got his own apartment. So he had a job as a security guard. He had a lovely girlfriend. He had his new apartment he was proud of, but no support system. And 3 weeks into his new apartment, he killed himself. So this was last month. He committed suicide. And he had a quick descent into depression and had a quick psychotic break, which is something you see on the streets of Seattle. Very often you see people that are having a psychotic break. Peter had a breakdown, but his break was simply to decide, I have to leave. So he left all of us behind. The thing that I wanted to tell you as part of this is that we're all in this together. There were 3 or 4 hands raised in the room. Everybody else has family, close community that has mental illness. And it's been something that hasn't been talked about much in our culture. To give you an example, having mental health care included in regular health insurance and being able to get care and treatment, that law was passed in 2016 in the state of Washington. And that's the case now. There are things that I think are direct asks that you should all consider after hearing this session. The first is to be more aware and to have compassion for the people that suffer from mental health care. The second is that we have urgently needed legislative change in the state of Washington. Just one of those things is that we should be able to have therapeutic facilities that are full-time facilities for children and young adults in the state of Washington. This should be something that we don't have to move these kids out to other states for all the families that experience this. We should have halfway houses, and we don't have them. And we should have long-term transitional facilities that provide support for people that need to be reminded to do things like take their medication. And long-term means up to lifetime. We need to take care of people. Finally, we need about a 500% increase, not a 20% increase. We need to increase funding. We have a lot of untreated mental health care. You see it on the streets. Most of the people that are homeless in the streets of Seattle are suffering from chronic long-term mental health care. And if you ask them, most of them have a relative in Seattle. It's over 80% that are local. So the thing that I would just want to say is that we have a deep personal loss in our family. And it's very hard for me to accept coming up here to introduce this program, but I think it's so important that we all open our hearts and we consider what does it take to embrace these people that are, in their own way, wonderful human beings, and treat them like they're equal and important parts of our community. It actually is a life or death issue. So with that, I'd like to introduce Mark Wright to introduce Katrina and Katherine. Thank you all.
I'm not sure how I'm going to be able to. John, thank you. So that's why we're here, you guys. That's why we're focused on this issue today. Mental illness does not care if you're homeless. It doesn't care if you're from a wealthy family. Millions of Americans are dealing day in and day out with mental health issues. Absolutely key, as John said, to this equation is getting help and support for those suffering. And that's what today is about. So we have two amazing women on stage today to help us better understand the title of our program, The Wide Spectrum of Mental Health. Katrina Egner, on the far end there, is Vice President and Chief Programs Officer of Sound, formerly Sound Mental Health. She has spent 25 years in the industry of treating those living with mental health challenges. Katrina, it's great to have you here. And in fact, Rob Stadler, our member, is chair of the board of Sound. Rob, thank you for your service to that incredible nonprofit. Yeah, that's worth applause. Also, to my immediate right, we have Katherine Switz with us today. Katherine is a Harvard MBA. She's related to Paul Suzman, which is worth something in and of itself. She is a wife, she is a mother, and she also lives with bipolar disorder. Katherine is also founder of the Stability Network, which is a nonprofit that believes people who have mental health challenges can not only live with them, they can thrive at work and in life. Katherine, it's great to have you here. So I want to make sure, first of all, we start off with Katrina. Why do you think it's so hard for us as a society to even talk about mental health?
I think it's a very good question. Let's see, is this working? Hello? Oh,
There we go.
Jeez, okay. Good, just making sure you're paying attention. I think that, first of all, it's getting a little bit better. You all are here today and invited us, and I can't thank you enough. Hearing the stories of John and his family and everyone else, it's helping bring the awareness. I think for a long time, mental health addiction has been such a scary thing for people. The way it presents in the street or with people people don't want to, they just don't want to talk about it. They don't want to look at it. They cross the street, they look the other way. We don't want to talk about kids with mental health issues. We don't want to talk about our family members. I have two aunts who both passed away when I was 14, one of brain tumor and one due to addiction and mental health issues. And guess which one my family, and I talk about this stuff all the time. You can imagine living with me, right? There's one aunt that we talk a lot about and about how she died, and there's another aunt that we don't talk about. I think there's a lot of mystery behind it and a lot of fear. I think that's the main reason.
Yeah, and in fact, I mean, if you look at some religious traditions, people who had mental health conditions were said to be possessed by the devil. So societally, we have this ingrained deep fear and mistrust of people with mental health challenges. Right. Katherine, I want to dive, I want to make sure that we get to what we need to get to in the amount of time that we have. So you have a Harvard MBA, you've worked at the top levels in the business world. Take us back to the time in your life when you realized that you had a mental health disorder.
Sure. I was first diagnosed.
Hold it just a little closer.
I was first diagnosed when I was a second-year student at Harvard Business School, and I thought I was Jesus. I was trying to walk on the Charles River. I was taken by ambulance to a hospital with a psychotic break, and in my case, with bipolar 1. 2 weeks later, I checked out of the hospital with a stack of prescriptions and the phone number of a doctor and student loans to pay for both. And so you can see the very dramatic beginning. And then somebody checking out, as you've heard today, very quickly without that support system. And that's how my story started.
Yeah. So you told me when we talked on the phone the other day that you can tell when an episode is coming on. I think it would be really important for us in this room to understand what it feels like to be in your head when something like this happens. Can you take us there?
Sure. I mean, first, what I would say is on the first two real true psychotic breaks, which have ended up in hospitalizations, I haven't known I was getting sick. I got sick so quickly. Now I've been able to sort of slow the tape, and I begin to see myself becoming unwell. So I might go into a Starbucks and think everybody's talking about me, or think the menu is vibrating. I've begun to pick up very vibrant colors and other things, and you'll hear from other folks who have lived with psychosis that those are early warning signs. And now I know, I go home and I call my husband. I call my doctor. In my case, I have a husband and a doctor to call, and they immediately tell me to go up on my antipsychotic medication, which I do. It still takes a couple months off my life because I spiral into a depression. But the fact is, I don't get as sick as I used to because I've been able to build this awareness.
Yeah. We're going to talk a little bit later about how important support systems are, how important it is for employers to be enlightened on the issue. But I want to go back to Katrina and talk a little bit more. We're talking about the spectrum of mental health. Can you kind of give us a snapshot, if you would, as to, I read recently that anxiety is at epidemic levels among young people in America. Suicide rates are going up among young people in America. Right. Give us, when we talk about mental health disorders, give us the broad brush of what's going on right now.
Yeah, so, I mean, earlier we asked, who all knows family or friends, and like you said, there was only 4 people. Can 2 people at every table raise your hand right now? Just any 2. So if there's more than 2, somebody put their hand down. But so if you look around, 1 in 5 Americans every year have some sort of mental health issue. And that's represented here in this room right now. Suicide is the 2nd leading cause of death for kids aged 10 to 24 in our state. It's 3rd nationally, but it's 2nd in our state. Life expectancy is down for the first time in 30 years it was a Kaiser Family Foundation paper that said that the reason for that is the opioid crisis and despair. Despair across our country and in young people. At some colleges, they're reporting that over 50% of young, college students are presenting to the counseling center with depression and anxiety. It's massive. It's a massive problem right now, and our community is really hurting.
So we're talking about a range of conditions, from anxiety, depression, bipolar, schizophrenia.
Exactly.
Anything else that I'm missing?
Everything in between. We've got all the addiction and mental health often cross over in the middle there somewhere too. It can be things that start off as grief or an adjustment issue because maybe there was a divorce or you lost your job. Those things can turn into mild to moderate to severe depression. Or anxiety disorders, so it covers the whole gamut.
So John talked about the need for increasing funding on this. If I have good health insurance and I have a stable home, I have a place to live, Katherine, it sounds like this is much more manageable, but what happens right now to people who don't have a home or don't have health insurance and are mentally ill? What happens?
Well, if you don't have a support system and you don't have a house and you don't have a job and you don't have money and you're being discriminated against and you're being incarcerated, you end up on the streets, you end up in the hospital, you end up in jail. In order to get good care and be able to heal, you can't just put someone in a house. You can't just take them to the doctor. You really have to wrap all of those services around people because it's the whole spectrum of care that's all tied together. So if we could increase funding, everyone would have all of those services available to them all the time. They would follow the people where they are.
Katherine, I'd like to know more about the Stability Network. It sounds like a really interesting organization that you founded.
Sure. The Stability Network we call it an emerging movement of people in the workforce speaking out about our own mental health conditions. So if you go to our website, you see 80 professional leaders raising their hands saying, I have schizophrenia, I have bipolar disorder, I have anxiety. And the whole goal is to inspire and encourage people with mental health conditions that they too can thrive. When I was first in the hospital at Harvard, I asked the doctor, can I go back to school? Can I take my job at McKinsey? And he said, you know what, Katherine, it could go either way. I never want anyone to hear that answer. I want people to see that it is possible to go back to demanding jobs and to have fulfilling lives and families.
There was a time in your career when you had an episode. Take us back to that time in your career, and how did your employer treat you? You don't have to name the employer, but how did your employer treat you? What was the response?
Sure. I've had two significant episodes while employed at major blue chip companies, and I think one of the reasons that the Civilian Network and other organizations are trying to open the dialogue on this is because companies and other workplaces simply don't know what to do. In my case, I had an anxiety attack. I was absolutely frozen for about 3 months. I couldn't focus on my computer screen. I couldn't perform. And I went to HR and said, I think something's going on, but I didn't know, I wasn't aware at that point to be able to name it as anxiety and to ask for legal accommodation, which exists. So for me, it ended not well. The company said, you really have a couple months to turn it around, and we want to see how you pull it out. And of course, in that case, I went into a very active mood state and did pull it out, and was able to stay. But I think there's just a huge issue with people understanding how to treat and accommodate people with mental health conditions, in part because we don't talk about them.
So imagine going to HR in your company, and let's say you are going to be treated for cancer. So my wife is going to start chemo next week. It's a very treatable form of breast cancer. But I want you guys to imagine for a minute going to HR saying, I have cancer. And HR says, you've got 3 months to turn this around. Think about that for a second. That's just as rational and irrational as the story you just told. The fact that it was 2016, and in my close today, we're going to talk more about Randy Ravel, our member Randy, who fought for decades to get mental health coverage covered by health insurance companies in the state of Washington. So there is this disconnect that we have in our society right now. We've got to get to the point where HR says, we're with you. How long is it going to take? We're with you. That's what would happen if you said I had cancer. That's not what would happen, and happens right now with people who are struggling with mental illness. I want to ask you, Katrina, to talk a little bit more about the way we look at homeless populations in Seattle. We kind of feel like, well, I think that we have a really simple view of people who are on the streets of Seattle.
Yeah.
They're crazy, they're addicts, or they're just losers, right? That's what most people think, I think, if they were really honest. Right. If you could reconstruct the current system, what would you do to reach those people on the street?
That's a great question. I wish it was as easy as one idea. The whole community really has to rally around this. I believe that if we can, not only do we need more housing, we do need more housing. It is so expensive to live here, and people are trying to get services here in the urban Seattle area. It's where a lot of services are, and they can't afford to live here. The housing, if you have a housing voucher, maybe it's $700 a month, but average housing here in Seattle is what? I mean, for an apartment is $1,300, right? And so housing's out of whack. But also more than that is we don't have the services we need to bring people to a place where they can accept housing, that they can stay in housing, that they can take care of their health care needs. A lot of the people on the street have serious medical conditions on top of mental health issues that they may not even know about, right? And so they're not welcome in primary care. They're not welcome in, there's not room in the shelters. And so we really have to redesign the system to have all of those things available for every single person. We have to go out to them specifically and make it easy to get into housing, make it easy to access services, and then follow them through the whole thing.
Yeah, because Katherine, it's not just take a pill and go home, right? Tell us what comprehensive care looks like.
Comprehensive care, I think, is first just medical care, and by that I say psychiatric care, a doctor, a counselor, a therapist, and not just any of that, but really evidence-based practices which are increasingly being adopted across the city and across the country. But it takes taking your medication every day. It takes sleeping 9 hours a night. I go to bed every night at 8. I wake up 9 hours later, exercising every day, meditating every day, cooking with my son, having just a really strict routine and regime that enables me to stay stable and healthy. And so, does that answer your question?
Yeah, it did. I want us to all get to a place of being more comfortable knowing what to do. Katrina, you said that there are actually mental health first aid classes. So
Yes.
We've all been to first aid classes to know what to do in a medical emergency. I had no idea until I talked with you on the phone the other day that we can take a first aid class to understand how we can meet people with mental illness. Tell us about that.
Yeah. So mental health first aid is a nationally recognized program. You probably remember Michelle Obama talking about it a few years ago. Right now, Lady Gaga is on a big campaign to try to get youth mental health first aid in all the schools. And it walks people through. You can go online and you can find an instructor in your area. It takes one day. It will lead you through how to recognize mental health issues, how to talk with people, what to do if somebody in your life tells you they're suicidal. So really, when you think about first aid in general, it is applying that to mental health. It's pretty fabulous.
Wow. You know, when you said that, it made me think that Robert, if you could set this up, I'd go to that class. I'd bring my son to that class too, who's in high school right now, because I feel like we are not at all prepared on how to deal with that. That's really encouraging that we can know.
Yeah.
Katherine, from your perspective, how should we treat people with mental illness? I mean, do you have any advice on what works and what doesn't?
I think the first thing, and I remember when I was at GE Capital and had a psychotic break, and I just wish somebody would say, how are you doing? What's going on for you? Instead of, you're being difficult or whatever might have also been the case. The fact is that I think just basic empathy can go a long way. Unfortunately, it's going to take a lot of opening up a lot of sessions like this before people who have, like me, who have mental health conditions feel safe asking for accommodation. So the best thing that you can do today is to go tell 3 people you were at this great session and this is what you learned and this is how your mind's been changed, because it's that ripple effect of people beginning to talk which will have the impact.
Yeah. What would you tell HR department heads?
And I want to be careful because there are a lot of great companies and some locally who are really trying to address mental health in the workplace. And as Katrina said, like in other domains, it's really complicated to figure out how to get people the care. But I would tell them to first create an environment where people can ask for help. Because until you have that environment where people ask for help, nobody's going to go to HR and ask for help. So that's the first step.
Yeah. And I feel like also, I feel like our society is just starting a period of enlightenment when it comes to addiction issues, when it comes to mental health issues, because for a long time we've looked at addiction as a weakness, a moral issue, not a disease. And I feel like we're sort of in that same spot when it comes to mental illness as well, that somehow it's something other than a medical condition, which is just crazy. What have I not asked you both that you are burning to tell our audience?
I would say sometimes people say, we don't know what to do. What do we do? And we sort of throw up our hands. We actually know a lot about what to do, including with the people living homeless. The fact is that there are good programs, there are evidence-based practices, there are organizations like Sound and others doing incredible work in the community, but they are under-resourced and they need our support. And so I think that's really important for people to understand.
Wow. Katrina?
I would just add, you said go tell 3 people. Go tell 3 people. Talk to people. If somebody is not doing well, ask them how they're doing. Look into, a lot of people, I think when you get overwhelmed by something, you can start to feel hopeless. And with the homelessness and all of what's going on in our world right now, it can be easy to just feel hopeless and sort of turn the other way, right? We can't have that. So please, all of you, go tell 3 people that you learned something about mental health and that there's a way to get involved, and then get involved, please. Thank you.
So it made me introspect a little bit this week when I thought about what I'm doing at home to create an environment for my kids and my family. I think we all have a responsibility, don't we, to really take a look at ourselves and say, what am I doing to talk about that relative who may have taken their own life in a respectful and honorable way? To create an environment of support and love and acceptance in our homes that encourages our kids to come to us when they're feeling like they're struggling with something. So, I feel like we all have a role to play. And I just wanted to talk about Randy Revelle really quickly. How many knew Randy in this club here? Randy really was one of my favorite people. And there was a time not that long ago that mental health was not covered, as you heard earlier, by health insurance companies. That changed largely because of Randy. Randy was a friend to many of us here. He also, as you know, suffered from bipolar disorder to the point that his family was at risk at one point, and he had to be committed. But Randy, like Katherine, had a very successful career. He was King County Executive from 1981 to 84. Randy was fearless about sharing his story. He shared it in big groups and small groups. He shared it in Olympia. He would share it with anyone who would listen. And I feel like Randy's in the room today because he was a pioneer, and he said what needed to be said, and he paved the way for insurance companies to open their eyes that they were discriminating against people with a medical condition. That was Randy. Randy passed away last summer, but I really believe that he set the foundation for this movement and this moment on stage today. I want to thank our 2 guests today. Thank you so much. President Cindy, back to you.